Hey, Dr. Lindsey and Wendy here. Today we're going to talk to you, this is an update on a Middle Eastern guy that we had to do a repair of his FUEs. And to summarize, he came in and asked me what I thought. And here's what he looked like. And I said, either you've had a bad hair transplant or you're going bald. And he told me that he'd had a hair transplant, a 2000 FUE transplant by a pretty well-renowned FUE doctor about 15 months ago. And what did I think? And
that's what they come and ask. It's like what they want us to guess whether what they had done, and it was either a bad hair transplant or he was losing his hair.
Yes. And so then he goes, "What are we going to do about it?" And I said, "I really can't tell you without knowing kind of where you started." So he was kind enough to bring in his pre-op pictures. And honestly, he looks about the same with his pre-op picture as he looked when he saw me after his 2,000 grafts. And then he brought in his end of the case picture. And first of all, you guys can count. That doesn't look like 2,000 grafts to me. Even if you did it with strip, that's simply not enough hair for that area. But it doesn't look like 2,000 grafts. And then we talk a lot about irregularizing the hairline.
Yeah,
the hairline's nice and irregular,
yeah.
but it's one graft thick, and so there's just no way that's going to be enough hair, right?
Yeah, and you can see a little bit of growth. And we saw when we did a case, he had we didn't have to irregularize it as much because he had a couple hairs.
Yeah.
Just here and there.
And then he essentially had no hair up the middle. So if you look back at his picture when he arrived here, or in his original, he had hair up the middle, and so I don't think that they really did anything in the middle except that's going to go away with his male pattern baldness. So we talked to him and made a plan to treat him as if he were a virgin head, essentially, with the few grafts that were there. And he needed his whole frontal third done, and he's probably going to need a second case down the road. And so, like a lot of guys, and if you viewers will look at our videos about how many FUE repairs we have to do, the trouble is FUE is just not as consistent, and particularly if you go someplace that it's more of an FUE chop, the roots get avulsed, or you get hairs planted without a root, or they're dry out. And it's a lot of work to do an FUE, and my guess is that he had a bunch of hairs harvested, but not many survived, right?
Yeah, that's how it looks like. So we ended up treating him as a kind of like a virgin head.
Yep. And so we did a strip case repair on him, and here's a picture of his donor area as we prepared to do a strip, and you can just see a ton of donor depletion, right?
Yes, yeah, you can definitely see all the little holes, and then when you lift the hair, his hairline, you can definitely see the thinning all around it.
Right. And so he's got the second curse of FUE, which is donor depletion. Curse number one is low growth and low density, and curse number two is lots of scar tissue in the donor area. So when we did this strip, if he had thick, bushy, wiry Indian hair.
Yeah, he's lucky that he had enough for us to do something.
And that hair is great quality hair. But if we'd have done a regular strip on him and he hadn't had any scar tissue, we'd have gotten 25 maybe 2,800 grafts, maybe even more.
More, yeah.
But he had a couple thousand holes in the back of his head, many of which had hair coming out of them, but still had scar tissue, and some of them which didn't have hair, which means that they actually got a graft in that spot. So I'll put up the number of grafts we got. I think it was around 2,200, 2,300 grafts, which is enough for what we needed to accomplish today, but it's always good to have more hair. We could have gone back a little further. So, buyer beware, make sure you know what you're getting yourself into, and look at examples of the doctor that you're going to's work.
And I think this is a great example of, because you do have your scar versus the FUE scars. So people can really make a decision too, they're right next to each other.
Right.
And that scar is almost invisible. And the dots, you can definitely see it.
Yes. So look at this short video sequence of his case. We're showing actual taking of the strip, trimming and preparing the front, making the holes, and then putting the grafts in. Then we have a picture at a week when he gets his stitches out. He did pretty good cleaning. And then the latest update. Okay, so this guy had a whole bunch of FUEs overseas and very little growth. And unlike the magazine ad where it shows no scar, this donor strip is chock full of scars. So we're going to fix this by cutting out this donor strip. I guess we'll get somewhere between 22 and 2,500 grafts. We'll sew this thing up in a tractivity closure and just pack his front. Okay, so this is the fellow that had a whole lot of FUEs overseas. And if you look in the recipient area, there's just no growth. I would hypothesize that most of those are hairs that were his natural hairs. I put a couple of numbing shots in, and we're just going to trim that and pack it as tight as we can get. So I just made all the slits. I went around a few of the areas where you had grafts, but he would have been hard to place with hair existing. I mean, those slits are hard to see, don't you think, Wendy?
Yeah, so there
terrible,
is, okay, so here is one, but you can't see it.
Yeah, let me get this. Yeah.
This one.
So if you had a whole bunch of hair there, like this fellow did at his original case, even if they got good grafts,
So you can't see that one either.
yeah, I mean, I
I had
couldn't
to go
see
by feeling.
where to make the holes until we trimmed him down, and then there's no way you could find the holes with a bunch of hair there. So if I were guessing, it was a combination of not getting a lot of roots out from the donor area, but costing me a lot of scarring, not being able to make the holes tight enough, and then the techs not having enough good hairs and not being able to get those good hairs
See them.
into the slits.
Yeah, see, like here they're disappearing already.
Yeah.
There's one.
But there's a couple places where I didn't make slits up there. because
Yeah,
we had
so that's
grafts.
why I go by feeling. That even makes it more difficult because when it's a virgin head, you pack them, and I know if there's a
No,
little
you can just sit right
space,
beside
there's
it.
going to be something right there. But with him, since we're skipping it, so I tried to go and see, like, that's a follicle right here, so I know that there's no slit there.
Okay, so we're almost done, and we got 2,113 grafts, I think, out of him. So if you look carefully, it's a little less dense in certain spots, and that's because he had some grafts, particularly here on the left side. And then we come across to the right side, and it's pretty homogeneous. I think if he wouldn't have had all those scars, we'd probably gotten 2,600 grafts out of him, which would have gone a little farther back. But that's what we got. And down the road, if he loses more hair back here, then we got plenty to work with. And it took a little less than 6 hours to do this whole thing. So now we're at day 8, and despite my best guess, this high IQ fellow did a great job cleaning. I gotta put my hand here so it focuses. That is a perfect job. And I always worry that these guys aren't gonna clean. That's perfect. I can't complain. No reason this won't work. I'm not sure why we came a day late, but this is at day 8. It's okay to get stitches out at day 8. And that looks perfect. It'll get a little worse before it gets better, and then we'll take a look. You can still see a few of the FUE spots that he got elsewhere. How much did it hurt this week? You can be completely honest.
Nothing.
Great. How many pain pills do you think you took?
Maybe like 1.
Okay.
So
his case went uneventfully. He did a pretty good job cleaning. This is him at a week when we took out his sutures. And then he came back in a month. He shed most of the hairs that we put in. And he's had shock loss of some of the hairs that were in the recipient area, as expected. But now by 3 months, he's back, and he looks about like he did when he first got here. So as I tell everybody, your real trouble is not week 1 to 4, but it's week 4 to 8 when you lose the grafts we
shed
put
all of
in,
it.
and you have some shock loss. So at a little short of 3 months, he looks just as good as he did when he got here, and that's going to be several more months before he starts to grow in the new hair that we put in. And then we look at his donor area, and boy, our scar is hard to find, isn't it?
yes, like I said, you can definitely you can make a decision on if you want the dots, blank, 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 or if you want
Small linear
a
scar.
small linear scar. So yeah.
And
Start
so
there.
this is 4.5 months since we did his initial case. And this is just added on to the video. He called the other day and said he thought he felt something odd going on in my scar. And so, man, that scar looks awesome. I put that up on the billboard of how to do scars correctly. And you can still see all those little white marks from showing
Right
that
there.
one time. So, yeah, go down a little lower one. Just like
Right
that.
there.
Yeah, lots of little white dots. They're hidden underneath that bushy wiry hair that this fella has got.
But
Been
if
found
he
by a
was-
scar, and I mean, you just can't find it. That's awesome. Here we go. All right, so this is 4.5 months out. Even though not a whole lot of our stuff's growing in, I mean, already you look better than you looked when you first got you here. So, and I don't have your face in this. How much do you have any pain or numbness at this point?
None.
Okay. All right. Well, we're slowly making progress. So I think that this fellow is now convinced that he probably made a foolish decision early on. Although our hair has not yet started to grow, we're pretty sure it will. We can do a lot of these, and statistically, he's going to grow in. I just don't know what month he's going to grow in. So again, buyer beware. Make sure you look at cases of the type that you were planning to get from the doctor that you were shopping with. And so, if you need a lot of hair, don't look at a couple of little cases. And if you need a little bit of hair, don't look at completely bald guys. Your doctor should have plenty of examples. And if he doesn't, then ask yourself why.
Yes, well, there is, we do our videos to educate you, and there is no reason why people should go in through a procedure without doing the research. There's plenty out there on the YouTube and...
Right. I mean, just yesterday we saw a guy that had signed up with somebody else. He got rescheduled a couple of times. He said there seemed like there's a lot of chaos at the office he had signed up with. And so he started doing research. Well, he'd already paid some money before he started doing research. And this is a guy my age who's got a lot of money. And he's an internet savvy guy.
Yes.
There's no reason why he should be doing research at this late date. But at least he did his research, or started his research before he got underneath the knife.
I think it was because it went, he kind of felt like it was a little crazy, and then he started really looking into it. But I think people should really look into it before committing to anything.
Right. Yeah.
Yeah.
So there's never an emergency hair transplant. There's no reason for you the potential hair transplant patient, to not do your research before you sign up. Don't follow gimmicks to last minute sales. 2 grafts per dollar for this week only. Do your research at your head and proceed when you're ready.
Yeah, I tell patients all the time, you can have $1 billion, but it's only X amount of donor area that you have in your head.
Right.
Money can't buy you that.
Right. So if we can help you, please give Wendy or me a call. Thanks.